But technically, if you look at it, when we started this hospital for first 2 years, majority of the months in a year, this hospital was a full private COVID hospital. And I would like to share that this hospital was one of the biggest private COVID hospital that time available across Uttar Pradesh. So this hospital really did some amazing work as far as COVID is concerned. We did a great service to humanity in the areas that we were offering the COVID services that time, because we were really first. 2 years was purely COVID. So after that, post-COVID is when this hospital started to complete overall non-COVID operations. So last year it had an occupancy of 30%, 31.3% to be exact. And if you look at the CAGR growth in terms of revenue from 79 crores to 102 crores, and then latest year did around 135 crores. So all our 4 hospitals, including the Jhansi Orchha that I will cover, are aggregated with NABH. NABH is the highest quality accreditation that you have in India for hospitals. 2 of our hospitals are also NABL accredited. That is the highest quality you have for pathology services, that labs that we have in India. And this Noida Extension Hospital, we have also applied for JCI, which is the highest quality accreditation worldwide that you get. Jhansi Orchha, this is the recent acquisition we did, and fiscal 23 was the first year of operations for this hospital. So it has a bed capacity of 305 beds, and it did an ARPOB around 17,692. So this is the hospital going forward. It is located in the region of Bundelkhand. So this is a huge population area where not many big facilities are available of this scale. And earlier there was a lot of patient volumes that used to come to Delhi from this region. In fact, it used to come to our hospitals as well. But now that's the strategy going forward, that all those treatments are now being offered in that region, and we see great scope of future for this hospital going forward. So overall, this is a summary, as I mentioned, for the hospital to a much more super specialty hospital. And recently, last 1 year, we're moving towards a tertiary care hospital. So that's why our ARPOB is increasing over the course of years, as well as occupancy has been increasing. A lot of hospitals during COVID, when they showed dip in terms of non-COVID operations are concerned, even our non-COVID operations during those years grew. Hospital's bed capacity, we have around 1405 beds, so quite similar to the scale of HCG in terms of number of beds. But we have huge plans in the coming years to increase this bed capacity. As I mentioned, the existing 2 hospitals, we are looking to expand the bed capacity. We have also in the process of looking out for new acquisitions that we will be doing, that I'll be covering in later part of our see from this slide, is our material and consumption cost is one of the least in the industries. We have around 17.9%. So we are we have kept a tight check in the supply chain is concerned. A lot of lean management was resulted in terms of procurement and very tight controls as far as stocks and leakages are concerned, which are leading to good material and consumption margins. Our employee cost again is on the lower side, so it's only around 17.7% for fiscal 23. And if you, in this figure, I'll also add that a lot of us support staff like housekeeping, security, these cleaning staff are also included in this cost. Whereas in a lot of other players, key players that we are doing the comparison in our peers, that is part of the outsourced services. So because we have not outsourced this service, so if you add that to our employee cost, it's still quite less in the industry. We have that we operate with. So 2 of our hospitals, being the largest private hospitals of Delhi NCR, we have a really strong presence in that area. As far as our geographies are concerned, we are the biggest player in terms of the Noida, Greater Noida, and Noida Extension region. We have a lot of patients who come to us from far across Uttar Pradesh. So our catchment is quite huge. Our Greater Noida hospital is located on the Taj Expressway. So we have patients coming from Bulandshahr, Agra, Mathura. So huge catchment comes to our Greater Noida hospital. As far as our Noida hospital is concerned, that is supporting the local Noida population as well as it's on the border of Noida, Delhi. So we have a lot of patients from Delhi, from Faridabad, states of Haryana coming to our Noida hospital. As far as Noida Extension is concerned, that in itself is a very high rise. And the Dr. Ajay, Dr. Kapil themselves being from the doctor background. So this thought process of medical profession is really embedded in our management. And that's what we like to continue going forward as well. And that's what doctors relate to, so that's a big reason why we're able to attract top and quality doctors. As well as our infrastructure is concerned, as you would have seen from the video, from 2018 and 19 is where we started our 2 big hospitals. So you can imagine the type of latest infrastructure we have in terms of the patient rooms and the OPD areas as well as the machines. We are probably one of the best in terms of Delhi NCR as far as the healthcare infrastructure is concerned, and that gives a big competitive strength to us in comparison to the hospitals that are present in our areas. Going forward is we will be continuing to improve our quality care and operational efficiency. So we are, as I said, we were focusing much more on the specialty treatments 3-4 years ago, and we are moving towards super specialty likes of cardiology, neurosurgery is increasing. So that really shows the trust of patients, in the areas we operate. Now, if they're coming to these high-end, life-threatening diseases, focusing and these are also high-end ticket sizes. So, for example, we started kidney transplant. An average kidney transplant is around $10,000. We started bone marrow transplant. So these are the super specialized tertiary care hospitals that we are moving to in the years to come. We are also, planning to start radiation therapy for oncology unit. As well as, third point is very key, medical tourism. So, the city of Greater Noida is coming up with Asia's largest international airport. The Jewar airport you must have heard about is going to start very, very soon. And this airport is just 25 minutes away from a Greater Noida hospital. So we already are the biggest hospital in the city. We are the closest hospital to the Asia's largest. You see, the likes of the other hospitals that are present in Gurgaon and Delhi, their proximity to the airport really helps them attract these international patients. And we feel in coming years, our area will become a hub for medical tourism, and we are already on the line to do those treatments. A lot of specialized treatments that we have started, like kidney transplants, we have done. Majority of these patients are international patients who have already started coming to us from across the world, who are coming to our hospital now. And that's a key area going forward also we will be focusing on.